Hi, I'm Jeff Smith, CEO of People with Disability Australia, and welcome to the first of our regular videos where we answer questions that you may have about coronavirus. There is certainly a lot happening at the moment. I've just come straight from our daily senior management team meeting about issues related to COVID-19. Immediately following this, I'll be going to a National Advisory Committee meeting, which is seeking to develop a specific plan for people with disability around how the health system responds to the pandemic. All of those meetings are held virtually, of course, at the moment as we're working from home. I certainly have been hearing lots of issues, stories and concerns from members and people with disability generally about the coronavirus and the impact it's having on people. I can assure you that we are listening and feeding that into the various processes that we're involved in and the everyday work that we do. There are certainly multiple processes ongoing at the moment. I'm having weekly meetings with our colleagues in the sector, as well as government agencies such as the Department of Social Security and the NDIA. And we're certainly having regular meetings with the ministers. In fact, I have a meeting with Minister Ruston later on this week. Thank you for all your questions. We've got a lot of them, which is great. We'll be putting the answers to most of the questions up on the website, while this video today just deals with the 5 most frequently asked questions. So question 1, I'll have to read it out. Can a disability service provider stop a person with disability living in a group home from going to their day program? There's certainly been a lot of changes and there are more coming to the way we get supports. But we have been talking a lot to the government, to the NDIA, to everyone we can, to ensure that people with disability have their supports continued. We don't think providers should stop their supports if they can do them safely, sticking to the rules around physical distancing and so on. So the answer, in short, is no, they shouldn't do that. So if that is happening, get in touch with us. We'll pop the phone number beneath this video so you can do that. Question 2. Can we get funding in consumables to cover things like hand sanitizer, gloves and wipes? The answer to this is no, unfortunately. The NDIS is saying that this is an everyday expense that everyone has, so it can't be covered by the plans. We have raised it with the NDIS and I'm talking with them later again today, so I can raise it with them again and see if we can get some changes so that everyone with an NDIS plan can get the protection that they need. Question 3. Can a support person who cancelled their service due to them being in self-isolation charge you for services that they would normally have done? If so, can you employ another support worker to cover the support? There have been some changes around cancellation of NDIS services that you need to know about. There are new rules that say that you have to give 10 days notice if you want to cancel a service, or you still have to pay for it out of your plan. Service providers have to make sure you are covered, but if you are self-managing, things aren't as clear as they could be. If you are still in doubt, get in touch with the NDIS Contact Centre, which has a number that you can call for that purpose. The number is 1800 800 110. 1800 800 110. And then you need to hit 5 to get a member of their special coronavirus team to help you further. Question 4. Is something being done to recognise and help those of us with disabilities who have to rely on public access computers at local libraries, councils and other public facilities so that they can conduct essential medical, social security and welfare-related business. We all do know how important it is that people with disability have access to the internet, particularly now with libraries and other public facilities closed. The good news is that you can now buy a device through your NDIS plan. Also, we're part of a broad coalition of groups who are fighting for cheaper broadband so that no one is left behind. Question 5. Why have disability pensioners been excluded from the coronavirus supplement, and what can we do about it? It is certainly the case that people with disability who rely on the Disability Support Pension, or DSP, have missed out on what is called the coronavirus supplement, which is an increase of $550 per fortnight. People on the DSP do get 2 one-off payments of $750, and I'm also happy to say that people with disability on JobSeeker, the old New Start, do get the increase. Lots of things are more expensive for us during this pandemic, like deliveries and extra supplies to make sure that we are safe. So it doesn't make sense that people with the people on the DSP miss out. We have been asking the government about this continuously, and we know you have been as well. I can assure you we're still working on it, and we'll let you know about any new developments or how you might be able to help. Thank you very much.